Okay. Hello, and welcome to our group counseling with Houston Christian University. We are in week 3, and this is our psychoeducational proposal group. And we are working on healthy relationships and boundaries. And this week, our focus is for theory and screening for the group. And so to start with part 1, we have Michaela.
Okay, for this section, I have the group purpose. So the psychoeducational group purpose is to provide the group members with skills necessary to create healthy relationships, and set clear boundaries. This will be done more through education rather than therapy. Setting boundaries and creating healthy relationships is essential if one wants to be both physically and emotionally healthy. After being educated about the skills needed, the members will have the ability to recognize the need to set and enforce limits. This would allow for protection of their self esteem, self respect, and to enjoy healthy relationships. And then psychoeducational groups focused on learning and prevention but have several purposes, such as imparting information, sharing common experiences, teaching people how to problem solve, providing social skills, offering support, and helping people learn to create their own support system outside of the group therapy. Core 23 also states that these groups are also designed to help members develop specific skills, understand certain themes, or progress through life's difficult transitions.
All righty, thank you. And we have Elizabeth with part 2, please.
So the primary framework that we're going to be using in this group is based on CBT or cognitive behavioral therapy. We decided to use cognitive behavioral therapy because it is skills based and it's practical and it also aligns with all the goals of our group. By using CBT, participants they are able to notice unhelpful thoughts about relationships and understand how these thoughts drive their emotions and their behaviors. So we're going to help participants use relatable examples to show that their thoughts and their emotions surrounding maybe pleasing people or other things might drive their behaviors that perpetuate this cycle of unhealthy relationships. We're also going to be using CBT to help participants identify common thought processes that keep people trapped in unhealthy boundaries. We're then going to use this CBT framework to challenge these thoughts with phrases such as, "What is the evidence for this thought?" and replace them with a balanced thought. We're additionally going to teach concrete boundary skills by practicing I statements or saying no without over explaining. The goal of these techniques is to allow participants to be able to invest in these activities while also strengthening their sense of community. Healthy boundaries and relationships are often guided by the thought patterns we're engaging in, and with this group, we hope to instill hope in group members that their thoughts do not always dictate the course of relationships or boundaries. And Corey also explains that these cognitive behavioral therapy groups they emphasize changing these self-defeating behaviors, and in a psychoeducational CBT group such as ours, the members or the participants may first identify common self-defeating behaviors that they all believe related to boundaries, such as if I say no, people are going to think something about me, or it's my responsibility to keep people happy. And the group facilitators are going to help the participants examine how these thoughts contribute to feelings of guilt or anxiety and kind of perpetuate those unhelpful behaviors.
All right, thank you. And Tina with part 3, please.
Okay, in this section, we're supporting theoretical perspectives. The primary theoretical framework guiding this group is cognitive behavioral therapy, or CBT for short. CBT serves as the foundation for understanding how thoughts, emotions, and behaviors are interconnected. Within the group setting, CBT helps members identify maladaptive thinking patterns, evaluate their accuracy, and practice more adaptive cognitive and behavioral responses. This approach particularly effective in groups because members can observe, practice, and reinforce new skills through interaction with others. In alignment with Corey's emphasis on integrative group practice, this group also incorporates interpersonal and systems perspectives to enhance the effectiveness of CBT. The interpersonal perspective allows members to explore how their thoughts and emotional responses are shaped within relationships. Group interactions provide opportunities for feedback, modeling, and corrective emotional experience, which are essential components of growth in a group setting. As Corey notes, the group itself becomes a social microcosm where I don't think I pronounced that right, but where members can gain insight into their relational patterns. Additionally, a systems perspective is integrated to help members understand how family dynamics, cultural influences, and social systems contribute to their cognitive and emotional experiences. By examining these broader contexts, members can recognize how learned patterns from their environments influence current behaviors. This perspective supports CBT by expanding self-awareness and promoting responsibility for change while acknowledging systemic influences. Together, these theoretical approaches directly support the group's objectives by fostering insight, improving interpersonal functioning, and strengthening coping skills. Drawing from multiple theories allows the group leader to remain flexible and responsive to the diverse needs of members. With Corey, identifies as a hallmark of effective group leadership. To ensure the group remains focused and therapeutically appropriate, clear inclusion and exclusion criteria are established. Inclusion criteria identify individuals who can benefit from CBT-based interventions in a group format and who are capable of participating in interpersonal exploration. Exclusion criteria help identify individuals whose needs may be better served through individual counseling or more intensive treatment. Establishing these boundaries support group cohesion, emotional safety, and the overall effectiveness of the group process.
All righty. Thank you, Tina. And Megan with part 4, please.
I will be discussing how the theoretical framework guiding our group is directly connected to the group's objective. So, cognitive behavioral theory, or CBT, supports the goals of this group by helping participants understand how their thoughts influence emotions and behaviors within the relationships. Many challenges related to communication, conflict, and boundary setting are shaped by unhelpful beliefs or automatic thought patterns that individuals may not be fully aware of. Using a CBT approach, participants learn to identify and challenge unhealthy or unrealistic thoughts that contribute to ineffective relationship behaviors. This directly supports the group's objectives of identifying healthy relationships, developing boundaries, and improving communication skills. According to Corey, in Theory and Practice of Group Counseling, effective groups are those in which goals are clearly connected to the theory guiding the group. By grounding the group's objectives in CBT principles, this psychoeducational group promotes intentional skill development and meaningful behavior change in a structured and supportive environment.
Thank you, Megan. And we have Kiara with part 5, please.
Okay, so for our group pertaining to healthy relationships and boundaries, it's structured around obviously instruction, skill, safety, and learning overall of each group member. We plan to show consistency when it comes to the format of each session directly towards how much or how the session will go about. Corey of 2023 emphasizes that structure is a central feature of psychoeducation groups. And so structure in our group will look like the proper check-ins, the time spent during each lesson, the skills through CBT as mentioned before practice, and how each group discusses and is navigating reflectively. Instructional wise, this group will be led with clear concepts put in place with the contribution of perspectives given by each group member, because it's important to us to be able to explain the difference between emotional boundaries when it comes to friendships versus romantic relationships. So role plays will, as mentioned, be put in place before and will be a key in the application of educational concepts with feedback given on both ends, which pertaining to strengths and weaknesses. And the safety in this group refers to the confidentiality and clarity given with the rules and procedures. And being able to just manage our time as leaders effectively each week, which goes along with the consistency. Along with the hands-on practice that will be displayed, we also would like to highlight the use of repetition during the practice. And just understanding this means understanding that this has to take place for mastery to take place. The encouragement of real life scenarios have to be put in action for the application to begin. So just establishing confidence in these people when it comes to the skills learned. So, yes.
Thank you, Kiara. And we have Aaron with part 6, please.
So my part is about the inclusion criteria. Inclusion criteria will be evaluated using a screening process as recommended by Corey. The people who we are looking for are actively seeking to improve their relationship and boundary setting skills. These people will also be able to pass a basic screening process. When using a screening process, multiple questions need to be kept in mind. Does this person appear to want to do what is necessary to be a productive group member? Has the decision to join the group been made by this person or by someone else? Will this person be able to accomplish group tasks? What does this person want to accomplish by being in a group? Is the individual open and willing to share something personal? How is this person likely to fit in with other members of the group? All of this needs to be taken into consideration when selecting group members. Additionally, the screening process should be a two-way street that allows for potential members to ask questions to determine if the group is right for them, as well as to begin to gain trust and leadership. All in all, members must have a capacity and willingness to examine their interpersonal behaviors, to self-disclose, to reflect psychologically on themselves and others, to give and receive feedback, and to have some capacity and willingness to engage with the other group members, as recommended by Corey.
Thank you, Aaron. And for part 7, we also have to consider exclusion criteria. As stated by Corey, 2023, leaders have an ethical responsibility to exclude individuals whose their needs cannot be met by the group. And so with that, individuals experiencing active domestic violence, severe mental illness, or substance dependence will be excluded from this psychoeducational group because their needs go beyond the group's purpose. This group is designed for learning, skill building, and self-reflection, not crisis intervention or intensive treatment, which they may need. Participants facing these concerns may need immediate safety planning, medical care, or long-term individual therapy, which cannot be provided in this setting. Including individuals with these needs could also disrupt the group's progress and reduce emotional safety for other members. Psychoeducational groups work best when participants are able to engage consistently, manage strong emotions, and focus on learning new skills. All right, and again, Corey explains that it is the leader's responsibility to manage the exclusion, emphasizing that exclusion is meant to be both protective for the individual and the group as a whole. Okay, and with part 8, we have Brittany, please.
Hi, so in my section is screening and ethical responsibility. For this group, screening plays a critical role in ensuring both ethical practice and group effectiveness. Screening helps determine whether the psychoeducational group is an appropriate fit for each participant, while it is also protecting the safety and well-being of all other group members. Because this group focuses primarily on education and skill building rather than therapy, it's also important that participants are emotionally stable enough to benefit from structured learning and group discussion. To support the process, brief intake interviews or screening tools would be used prior to group participation. These tools help assess participants with goals, current stressors, and any other concerns that may fall outside the scope of this group. Individuals who are experiencing active domestic violence severe mental illness or substance dependence would be referred to more appropriate services that are out there. Corey emphasizes that screening is not optional, but an ethical responsibility of the group leader. As Corey states, screening is an essential part of ethical group practice. By carefully screening participants, the group leader promotes safety, protects vulnerable individuals, and ensure that the group remains aligned with its psychoeducational purpose. So ultimately, ethical screening straightens the group experience by creating an environment where members can learn, practice skills, and grow within appropriate boundaries.
All right, thank you. Is there anything else that anyone would like to add for this week for theory and screening? Okay, great. Well, I will stop recording.